Good afternoon. Lovely to see you all here. Yeah, I'm really delighted that we just heard the approach as one of addressing a whole system change, of tearing down the barriers between the silos, really going for a cultural shift, because that is what I think we need. But first, I'll take you into the clinic with me. I'm a neurologist, so I see people with chronic brain disorders, with acute brain disorders. And one thing that really strikes me and has been striking me for years in the clinic is that the people who are active, who are physically active, who are eating healthy diets, who are active in their communities, who are connected, they are doing hands down better, even with a diagnosis that might be, beyond cure, than the people who are not active. And it makes such a big difference that studies have now shown this actually is a question of adding several years to our lives, with and without chronic conditions. And we know that many conditions are closely linked to lifestyle. In fact, actually about 75% of the US health budget goes to chronic conditions. And those are diabetes type 2, there are stroke, there are heart attacks, there are other heart conditions, there are several cancers, there are depression and mental health, there are Parkinson's, Alzheimer's, so other dementias as well. There are obesity, there are joint problems, so osteoarthritis, for example, falls, and the risks of falls like fractures. So all of these conditions are directly related to how we live our lives. And for the most part, this is something that we ignore in the clinic because we prescribe medications, because there are no good ways, no good avenues to prescribe exercise and healthy diet. And so with that, several years ago now, Dr. Jack Taunton and I talked and said, well, we actually need to change that. And that was the reason why we found the BC Brain Wellness Program, to overcome those barriers that people, particularly living with chronic brain conditions, have, so disabilities, some reluctancy to go to the community center, cost associated with that. Maybe you get a program for 12 weeks, some physiotherapy, but then after that you can't continue, and you of course need to continue. It's like brushing teeth. You can't stop after 12 weeks. You got to do this lifelong. So we found the BC Brain Wellness Program to offer low-cost, low-barrier, accessible, appropriate, but yet challenging programs that are cost-free for the most part for our participants, for exercise, for physical activity. We've got yoga, we've got dance, for healthy eating, for being connected, socially connected, because that happens when you go out and do activity together. And that has then led to a real change in many people's lives. So one story I want to share with you is that somebody I've been seeing in the clinic for a long time, they had a movement disorder where their head kind of is involuntarily turned over to the side. So you can't actually, you want to look forward, but you can't because your head is over to that side. It's very painful. The muscles are constantly spasming. He had to give up driving. He had to give up cycling. He gave up all the sports he was playing. He was now really depressed. His cycle of life kind of was getting increasingly small because he was at home and feeling also unable to really take control of his situation. And then he started training with us, still coming 4 or 5 times a week, and went back to cycling, went back to playing other sports, is much more engaged in the community. His mental health hugely improved, and that then sent him on a completely different trajectory. So this downward spiral that was happening before, where you can't be physically active, then you're socially more isolated, which has an impact on your mental health, which means often that diet deteriorates as well. This downward spiral, that was stopped and it was reversed. And by just addressing some of these issues, and particularly being physically active, and that then is often paired also with eating more healthily and being socially connected, you can start an upward spiral of healthy living. And that is really what we need. But for that, we need to really have a system change. We need to look at prevention in medicine. We need to start way earlier than seeing people when the illnesses are already all established. We need to start with prevention. This needs to be part of the medical system, but it needs to be part of our overall society. It needs to be in the built environment. It needs to be in the schools. It needs to be in what we do in our everyday life and work, in our higher education. Yeah, and so I was incredibly encouraged by what the minister just said, that they're looking at the systems approach, they're looking at tearing down the barriers and the walls, whilst also working with the local organizations, the grassroots organizations like the BC Brain Wellness Program, for example, to see what are the barriers, what is actually happening on the ground to keep people from living healthy lives. And so with that, I'm incredibly happy that, John, we have this very special day dedicated to active living, to healthy lifestyles. And I think all together, we're the beginning of a movement and we can make a huge difference, and we need to make that difference. Yeah, and that's what I have to say.